Hello, listeners. Welcome to MHT Conversations. This is Havisha, your host for today. And before I welcome our guest for today, it's a new information for us as well as everyone who is listening to this. That along with Autism Awareness Month, it's also PMDD Awareness Month. And for the same, we have Miss Anuhya, who is the founder of Beyond Blood organization.
So I started Beyond Blood around 2019. It was about 6 months or 7 months after I was diagnosed with PMDD. That was after I started my treatment and I was starting to feel better. And I just thought to myself, I had really great support system. I was diagnosed. I had money to afford the treatment.
Correct.
What about other people?
Yeah.
Like, even if you had the money and if you're not able to get diagnosed, or what if it's treatment's not accessible? And more often than not, it's always trivialized, right, when it comes to women's health.
Yeah.
So I figured if someone has to do something, it can be me. And that's how I started Beyond Blood. Initially, it was just a platform for a support group for people in India to come together and discuss and find ways to cope. Eventually, with a lot more people joining us, I registered the organization and we've been applying for grants. So that's how it started off. And we use an approach called the life cycle approach to deal with menstrual mental health. That is looking at it as a biological reality, going from menarche to menopause, identifying that at all different parts of life, there are different mental health needs.
So coming to the topic of this month's awareness, which is PMDD. So how would you describe what is PMDD?
So PMDD is essentially a cyclical mood-based disorder. And it's directly related to menstrual cycle. All the symptoms of PMDD are experienced in luteal and late luteal phase in the menstrual cycle. PMDD was recently added to ICD.
Okay.
And was recognized by WHO in about, I think, 2019.
Okay.
Because of which now not only mental health professionals, but also gynecologists, endocrinologists, reproductive endocrinologists can also diagnose it.
Okay.
One of the reasons for this move forward is because when it came to PMS-like symptoms, and most women describe PMDD as severe PMS, they were approaching their gynecologist. And PMDD was in DSM from 3R till I think 5, and then introduced in ICD as well. So because it was only in DSM at that time, only a psychiatrist could diagnose it, and people were not approaching a psychiatrist because they were like PMS-like symptoms.
True.
So by adding it to ICD right now, gynecologists also can diagnose it, making it very legitimized, very accessible diagnosis. PMDD is often described as severe PMS. And I think that's the best way for people to understand it. But I think it's a little reductionist approach. You don't say migraine as severe headache, right?
Correct.
Yeah. So that's why I find that a little reductionist. What's happening in PMDD is that the brain at a cellular level is having a severe allergic reaction to the natural rise and fall in estrogen and progesterone that happens in the cycle. So the brain is unable to cope up with it, and it is not hormonal imbalance. A lot of people confuse it for hormonal imbalance, but it's not caused by hormonal imbalance. Studies have found that it could be genetic. Even brain imaging studies have shown that there's actually the way the brain lights up in the MRIs is completely different in people with PMDD during the luteal and late luteal phase versus people without it. Some of the symptoms that people experience are not just emotional experiences, but also like physical symptoms. In physical symptoms, breast tenderness, water retention, joint pains, cramping, and emotional symptoms, mostly rage, interpersonal conflict, irritability, and suicidal ideation. Suicidal ideation is the most prominent and debilitating symptom of PMDD. Whether it's active or passive, it's still debilitating. In fact, studies have shown that over 30% of people with PMDD try to commit an act of suicide. So it's really difficult because 30% is a huge statistic. And more often than not, because bipolar is a known disorder, people with PMDD are often misdiagnosed for bipolar because they feel better and they're happier in the follicular phase before ovulation.
Yeah.
And then immediately after ovulation, they experience, depression sort of episode. So because of the manic and depression cyclical symptoms that are coming, more often than not, they are misdiagnosed by bipolar. And health outcomes of people who are misdiagnosed with bipolar are not good because it's completely a different disorder that has completely different treatment and medication. For that reason, we need PMDD awareness. We need mental health professionals to know, okay,